Hi everyone, my name is Aryaman and I'm a medical student at UBC, and this video series will go over all the different aspects of becoming a doctor in Canada and the path to medicine from high school to residency. Medicine is the field of healthcare that's devoted to diagnosing, treating, and preventing illness. But at its core, it really serves to improve health of individuals and their quality of life. Doctors work with individuals, they work with teams, they work with families, they work with entire communities even, to help guide people through making some of the most important and sometimes most difficult decisions that they'll ever take in their life. And because of this, becoming a doctor is one of the most demanding careers and at the same time one of the most respected professions in Canada. Becoming a physician requires years of training and a lifelong commitment to learning. Physicians can choose to practice areas of medicine as broad as general family medicine or as specialized as interventional neuroradiology. What draws many students to the field of medicine is its unique blend of science, decision-making and problem-solving, teamwork and collaboration, and most of all, the ability to make a meaningful impact on the lives of so many people. The journey is demanding, but for so many people, it's as deeply rewarding. Now, if you're thinking about medicine early, high school is really where the foundation of this all starts. Most medical schools in Canada require you to do 3 to 4 years of an undergraduate studies program. And so then the main goal becomes in high school to get yourself into a strong bachelor's degree program of your choice. Most successful applicants tend to do well academically, especially in courses that are science focused, for example, maths, physics, chemistry, and biology, all whilst maintaining that balance, because schools look for more than just your grades. It's important to demonstrate leadership, teamwork, and community involvement. For example, these can be done through taking on clubs at school, getting involved in student leadership, or volunteering. It's important to note that these activities don't just strengthen your application later on, but they also help you build those habits and those skills that will serve you well throughout the rest of your university career and medical education. Another very common question high school students have that would like to pursue medicine is, what courses should I take in high school, especially in grade 11 and 12, if I want to pursue medicine? And the answer to that question really depends on what bachelor's degree program do you first want to pursue. Later on, I'll discuss how to get into medicine, really there's no one set pre-med degree. It really varies. People can do conventional degrees such as biology, or people can do non-conventional degrees such as music. But what matters is that you meet all the prerequisites for your desired bachelor's degree program. And to do this, it's best to talk with your school counselor or check UBC's website, for example, or other universities that you're interested in, and see what requirements they state depending on your school system. For example, the Dogwood Diploma in BC, there is a bunch of courses that UBC's Bachelor of Science degree program, which is a very common pre-medical degree, requires you to do, including grade 11 math, physics, chemistry, biology, English, and even a second language. So the requirements really vary, and they depend again on your desired bachelor's degree program. And so checking their respective websites and even getting in touch with them via email or phone is a really good idea to make sure that you meet all those requirements. The undergraduate years are the most important stage in preparing for medical school. Most Canadian applicants take 3 to 4 years of undergraduate studies, typically a bachelor's degree, before they apply to medical school. This is because medical schools in Canada require you to do a minimum of 3 to 4 years of studies. It's important to note that there is no single pre-med degree that you can take out of high school. Many successful applicants choose conventional streams such as biology or neuroscience, but it's also important to note that there are a lot of successful applicants who take non-conventional streams such as psychology, sociology, or music, And it's also important to note that many successful applicants are master's students or even PhD students. What truly matters more is that you take the prerequisite courses that are required for you to take by the respective medical schools. For example, UBC has previously required you to take 2 semesters worth of English in your undergraduate studies. It's typical for Canadian med schools to require you to take biology with labs, biochemistry, inorganic chemistry, organic chemistry, and English. These are some of the most common prerequisites that most schools require. However, these do vary by the school and these are constantly changing. So I highly urge you to please keep yourself updated with the prerequisites of each school that you are considering applying to. Now, coming to one of the most commonly asked pre-medical questions is, how much do grades matter? And the short answer is that grades do play a major role in your medical school admissions. Most successful applicants have an average GPA of about 3.8 in their undergraduate years, or if we're talking about percentage, around 90%. Many schools also require you to take the MCAT exam, which you may have heard, and it's known as the Medical College Admissions Test. This assesses topics such as chemistry, physics, biology, biochemistry, psychology, sociology, and it also includes the CAR section, which is known as the Critical Analysis and Reasoning Skills section. Most students tend to take this in the summer after the end of their second year or at the end of their third year after studying for the entire summer of about 3 to 4 months. It's important to note that not every medical school in Canada requires this, and those that do tend to weigh differently as well. For example, some medical schools tend to focus more on the CAR section and give it more a priority. Now, coming to one of the most frequently asked pre-medical questions, which is how much do extracurricular, or also known as ECs, matter? So let's break that down. Most successful applicants typically pursue clinical and non-clinical activities throughout their undergraduate years or before applying to medical school. Examples of clinical activities include hospital volunteering. These include research projects. It can include mentoring, student leadership, advocacy. Examples of non-clinical activities that a lot of students also do includes music, it includes arts, it includes sports. So you can see the range that's present there. And it's really important to note that non-clinical activities are equally important as clinical activities, as they demonstrate your ability to balance and they also demonstrate how well-rounded you are as an individual. It's really important to also note that it's a good idea to keep a log of all the activities you pursue and all the hours that you do, because these will come extremely helpful when it comes time to medical school applications and even in interviews. One final tip that I'd like to give is that it's always a good idea to pursue an activity for a longer time and make sure you're thoroughly involved with the activity. Medical schools really like assessing how deep you're involved with a certain activity, as it shows your commitment and your growth throughout that process, instead of doing multiple activities for a short amount of time and involvement. Medical school applications in Canada are multi-step and highly competitive. They require you to submit your academic grades, your MCAT scores if required, a list of your extracurricular activities, personal essays, and also reference letters. Many Canadian schools also require the CASPER test, which assesses judgment, ethics, and professionalism. If selected, applicants are then invited to interviews. Remember, medical schools are looking beyond your grades. They want people who are reflective, resilient, and people who can thrive in demanding environments and are good collaborators. Canadian medical school programs are typically 3 to 4 years long. The first half, so years 1 and 2, focus on learning the key concepts, and you spend most of your time doing lectures and small group sessions where you learn topics like anatomy, physiology, pathology, and also clinical skills. In the second half, so years 3 and 4, you then go on to do clinical rotations in sections and areas such as internal medicine, psychiatry, pediatrics, surgery, OB-GYN, and this is where you finally get the chance to apply the knowledge that you've been acquiring in your preclinical years. After medical school, graduates apply to the Canadian Residency Matching Service, also known as CARMS. Residency is essentially a full-time paid training under expert supervision. Residency length typically varies, with family medicine residency lasting 2 years long, internal medicine and pediatrics lasting 3 years long, and surgical specialties such as neurosurgery, for example, lasting between 5 to 7 years long. Some residency specialties are less competitive to match into, while others are more competitive to match into, and all this information regarding match rates are available on the CARMS website for you to review. To practice independently in Canada, physicians must complete several steps. The first one being obtaining your licensing. Licensing is obtained through the Royal College of Physicians and Surgeons of Canada or the College of Family Physicians of Canada. After this, physicians may choose to work in hospital settings, in clinic settings, in urban centers or rural centers, or pursue academic or research careers. Many also choose to pursue fellowships to further subspecialize and fine-tune the patients they see and gain more knowledge and expertise. Career advancement in medicine looks quite different from career advancement in other fields. It's less about hierarchy and it's more about expertise, leadership, and impact. What truly shapes a physician's career over time is continuous education, experience, and reputation. Many physicians choose to pursue subspecialty fellowships or take on academic or leadership roles. And there's also many physicians who choose to pursue an additional degree. For example, many choose to do a master's of public health or a master's of education so that they can further expand into the realm of administration, education, and public health. Medicine is fast-paced, demanding, and emotionally challenging. Long hours, high responsibilities, and continuous learning are all part of the profession. At the same time, it offers deep purpose, and medicine offers human connection. It offers you the ability to improve someone's lives in tangible ways. So ask yourself this question: do I like decision making and problem solving? Do I like learning about the human body? Am I motivated to serve others even when the situations get difficult and challenging? If you said yes to any of those questions, then medicine may be the right path for you. It's long, it's demanding, but for so many, it's worth it.